Dr. Charis Meng, and I'm from the Hospital for Special Surgery in New York. And I'm here at the CRA presenting our poster from Catch called "The Presence of Painful but Not Swollen Joints is Associated with Worse Function, Work Impairment, and Health-Related Quality of Life Outcomes in Patients with Early Rheumatoid Arthritis." And the reason we're doing this study is because a lot of patients with rheumatoid arthritis have more tender than swollen joints. It's common. And this can sometimes be associated with conditions besides rheumatoid arthritis. And this is important for both patients and their rheumatologist to know about, because if their symptoms are from conditions outside of rheumatoid arthritis, then the treatment would be different. And what is not known is whether patients with these high tender swollen joint differences, which joints are involved, large joints, small joints, and how do they impact function, health-related quality of life, and other important patient-related outcomes. So that was the purpose of this study. And what we found was that patients with high tender swollen joint differences were common. At baseline, over half of the patients had it. And even after a year of treatment, which you can see here, this is at 12 months, and they've been treated, it persists in about a third of patients, so it remains common. And importantly, what these two graphs show is that compared to patients who don't have it, having more tender than swollen joints is associated with worse work impairment, activity impairment, function, sleep, pain interference, fatigue, and function of the upper extremity. So it has a lot of impact on patient-reported outcomes. And the changes were especially striking when large joints were involved, such as shoulders, elbows, and knees. And a key takeaway for patients is that if you feel that you're having more tender joints that involve your large joints in particular, to raise this with your rheumatologist, and this may help in identifying earlier interventions for you.